continuing on our theme of helping people, especially priests, and also in this particular case, sisters as well, nuns. Even in the best of times, men and women religious fall prey to substance abuse, and be it alcohol or drugs or whatever. We have a pioneer program, Cardinal, that you're very familiar with here in the Archdiocese of Detroit, Guest House. And pleased to welcome in Kathy Schiffer. You're a director there for special events. You handle communications and probably 5 or 6 other things as well. And Dan Kidd, you're the president and CEO.
It's a pleasure to be here.
You have this history that ties to the Archdiocese of Detroit, but talk a little bit about what has happened over these, 50-something years?
Guest House has been here in the Archdiocese since 1956, so 52 years ago. Our founder, Austin Ripley, with the assistance of Cardinal Mooney and a couple of very important people, Robert Sage and Emmett Tracy, were able to put together a package to get Guest House started. And it became really the first modern successful treatment program for priests who have the disease of alcoholism. Since that time, we have treated over 7,000 priests. In fact, I had a bishop tell me one time, he said, you've probably seen more priests pass through your doors than any healthcare facility in the 2,000-year history of the Catholic Church. And I said, you're probably right. We have seen a lot of priests, but we've helped a lot of priests with a very high effectiveness rate in that period of time as well. We've diversified a little bit over the years. In 1969, we added a program in Rochester, Minnesota to treat priests with alcoholism. We use the facilities of the Mayo Clinic to provide all the medical care and the psychiatric care for priests who need that at our Rochester, Minnesota Treatment Center. But then in 1994, we opened our guest house for women religious here in the Archdiocese of Detroit on our campus in Lake Orion. And we've treated about 350 sisters for their addictions since we opened that program in 1994. And then since then, we've added a halfway house in Lake Orion for priests in 1999, again with the assistance and support of the Archdiocese of Detroit and Cardinal Maida. And then 2 years ago, we opened a program in Philadelphia, outside of Philadelphia, in conjunction with another treatment program for priests called St. John Vianney Center, where we treat priests who have more than one diagnosis. More than alcoholism, perhaps alcoholism plus depression. We can treat that in that kind of setting very effectively. And then this past January, we took over a facility in India, in Mangalore, India, where we treat priests with alcoholism from Asia.
So you are invested in this. I wonder if, Kathy, if you know, there are 50-something years of history here. But alcoholism is still alcoholism, and I don't mean to categorize it necessarily that way, but the world has changed so much. Has some of the treatments and the care and the approach changed as well?
Yes, and what we treat for has changed in that with the women's program, we treat women religious not just for alcoholism and drug dependency, as we do the priests, but also for compulsive spending, compulsive gambling, and eating disorders. So the program is expanded. Also, one thing that I think we should mention is that it's not only priests and sisters, but also deacons, religious brothers, and seminarians who are eligible for treatment at Guest House.
Cardinal, as a bishop, you've my guess is you've had to rely on this for once or twice with one of your priests, and how thankful you must be that there's a place to be able to go.
I think I can relate to every parent out there who has children and or family members. There's always somebody who has a special problem or need. We live in a human condition, and there are many reasons for these addictions of one nature or another, and it affects us too as priests or religious in our life. And I think in the past, oftentimes maybe people just characterize this as some weakness or some sinful conduct which brought these people to these situations, but we've known through study and through science that there are these addictions, and it's a sickness. And it's a sickness which can be treated, and the people can be helped. And so that we're grateful for something like Guest House, where they focus on religious people, men and women, and try to help them. And I have to say that I'm very happy to say that most of our people are okay. We don't need your services. But there are some who do, who are afflicted because they're part of the human culture, the human condition, and circumstances which cause these addictions. And so that it's wonderful, and we're grateful that you have those, give them the opportunity and the hope that they can conquer this with proper treatment.
You know, they say that they say this about doctors, that they make terrible patients themselves. How is it with priests and women religious? Do they? I don't mean to generalize, but do they make good patients, or is there some resistance there? Not unlike there probably would be with anybody else who goes into a treatment facility sometimes. Actually,
there are a lot of similarities between priests and doctors when it comes to dealing with problems. They tend to have been so well educated and tend to begin to think that they really shouldn't have these kinds of things happen to them. So it's very difficult for them. On the one hand, they're very good in treatment because they tend to obey the rules and be compliant and get up for group therapy when it's supposed to be at the right time and do what they're supposed to do. On the other hand, the acceptance factor can be very difficult. And really, in order to eventually improve, during the process of treatment, a priest needs to begin to accept the disease that he has, or a sister would need to accept the same thing in her treatment program to begin the process of recovery really getting going. And it's very, very difficult. You know, we often think that doctors tend to think that they're God, and sometimes they do. But priests actually sometimes know that they are God, in a sense, in the person of Christ. And it does create a bit of a difficulty when it comes to accepting the fact that there is this problem. The good news is that when they do accept it and when they get better, they become better priests. We were in Maine this past weekend for a fundraising benefit for Guest House, and one of our priests was there. And the statement that he often makes is that Guest House made me the priest I always wanted to be.